Welcome everyone to Diabetes Canada's Type 1 webinar series. My name is Farah Ismail and I will be your host for today. We are delighted that you're able to join us today for a webinar to learn about budgeting for diabetes health costs. Now to start off, I would like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order for Diabetes Canada to better serve your needs, we kindly ask that you complete the short survey towards the end of today's presentation, and we thank you in advance for your input. Throughout our presentation, you will have the opportunity to ask questions, and this can be done simply by typing your questions into the Q&A box, which is located to the bottom right-hand section of your screen. And our presenter will be happy to answer them at the end of the presentation. As well, we will be displaying a few polling questions throughout the presentation and would love for your participation. Please note that your answers will remain completely anonymous. You're also able to customize your screens. You can expand or collapse them as you see fit, and that can be done easily by dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will last about 30 to 35 minutes in length, and we'll have another 10 to 15 minutes at the end for questions. I would like to note that today's presentation is recorded and will be made available at the Diabetes Canada website in the coming weeks. Now I'd like to welcome our speaker, Diana Provenzano, and thank her for joining us today. But before turning it over to Diana, I'd like to give you a brief introduction. Diana Provenzano has held various senior financial positions. She currently provides financial advice to individuals and small businesses, including assisting clients with obtaining their full tax benefits. She is a Diabetes Canada board member and audit committee chair. For more information on Diana, please read the speaker bio section, which is located to the left of your screen. So without further ado, I present to you Diana Provenzano.
Good afternoon, everyone. So before we talk about health costs, I'd like to provide a short overview on how to manage your money, where to save your money, and then we'll review the medical expenses in more detail. So let's begin. So how do we manage our money? There are numerous resources you can seek, and some of them I have listed at the very end of this presentation. There's about 3 slides of resources that are available to you. Part of living well is feeling secure about the money you have and being able to pay your debts on a timely manner. Credit cards and line of credits have made it easy to live beyond our means today. We need to spend less than we earn. Currently, 62% of people plan to go into retirement with debt. How are they going to manage when retirement income is usually 50% less than their current income? We could also manage our debt all our life and yet still have no savings for those unforeseen expenses, including our medical expenses. Therefore, it's important to pay yourself first. Before you spend, set aside some funds for the future. Live within your means. Let's do a quick quiz of what stops you from managing your money. So what do you find most challenging when it comes to manage your money? Select all that apply. I'll give that just a few seconds. Oops, back. I probably did too quickly. So, it's too complicated. Well, actually, that's the second most common response that we get to this question. And the reason for it, people read throughout the papers or they hear in the news all these different types of investment vehicle options. Oh, first step is to step back and not get inundated with all the different short terms of various different vehicle options. Start with your bank site. Go to your financial institution and start with small steps before you start absorbing all the different types of investment vehicle options that are out there. The other common question and answer was, I don't have time. Well, if you don't have time, who's going to be taking care of you later in life? With 30% of people not managing to get with a partner throughout their life and 40% ending in divorce, if the only person looking after you should be you, your money, you need to start taking action. And starting at any time, it doesn't matter when, is better than not starting at all. And another little comment I just want to make is with regards to the government will look after me. Well, maybe you may not know that the government old age pension that one would be entitled to is only $584 a month, or that's $7,000 a year. And your Canada pension plan at only $1,000 at maximum dollars a month, that would only give you about $20,000 a year to live on, certainly below the poverty level, and therefore certainly not enough to manage your medical expenses on a go-forward basis. So let's see how we can actually start managing our money. So where to begin? The very first thing I tell everyone is to track your spending for the next 30 days. There are numerous telephone apps, if you'd like to use a telephone apps, a computer software programs. There's simple Excel sheets that you can actually use for tracking your spending. And many of these resources are listed at the end of this presentation. Categorize the spending: food, entertainment, eating out, transportation, cell phone costs, etc. Record everything, including that daily coffee you drink, which if you spend $5 a day on a coffee, that amounts to $1,820 a year. The monthly fixed costs, mortgage or rent, utilities, insurance, need to be paid first. Then the rest are to be considered on how you can reduce those expenses. Most importantly, as part of preparing your plan and tracking your spending, is to manage your paperwork. When things come due for payment and when there are for renewal, you need to set up some calendar reminders, either on your phone calendar app or on a paper calendar. Because if you want to negotiate better terms for any of the services you currently use, you need to do this approximately a month in advance of the renewal date. So some areas that you can consider to reduce your cost. First of all, if you have combined services like phone, Bell, cell phone, internet service, cable TV services, combining them all under one provider may reduce your overall cost. You should check the provider's webpage or call them every 6 to 9 months to see what new offers they have available to you. No one wants to remain on a phone line indefinitely, so to ask a supervisor immediately upon getting on the line, and also indicating, if applicable, if you're a loyal customer. Because as soon as you indicate you're a loyal customer and you want to get better pricing, you do get prioritized in your phone call that you're making. Combining your car and home insurance needs to one provider also helps in reducing costs. When you're going out grocery shopping, matching prices, check for the weekly deals on the paper. And remember that when you're banking, that if you have multiple services at one banking institution, again, sometimes the monthly banking fees on your bank account can actually be reduced by advising them that you have both a checking account, a savings account, and maybe one of your other savings accounts that we'll be speaking to shortly. Now let's look at credit cards. First of all, if you do have credit cards, I strongly recommend that as soon as you receive a credit card, that you note down what its payment schedule requirements are for that credit card. And that you use your credit card for your needs, not your wants. I know that's difficult, so determining what are the needs versus the wants. But if it's something you need, it should have been already picked out in your budget spending. And if it's something you need, then you should have enough in your budget for it. And therefore, when that credit card statement comes, you need to pay it off fully every month. Now let's say we cannot pay it off fully every month. Let's take an example. So if I have a credit card balance of $4,000 and you're requested to make the minimum monthly payment of $120. You're not going to add another purchase onto that credit card. It's going to take you, if you pay the $120 every single month, it's going to take you 28 years to pay off that card. And in addition, you'll have had paid $12,550 in interest. A very expensive purchase for that $4,000 that you originally thought of. Now assume you pay an additional $1 a day to the minimum amount of the $120. So instead of paying just the $120, you pay $120 plus $30 for a total of $150 a month. You will have the balance paid off in 3 years and 6 months as opposed to the 28 years. And the interest that you will have paid is $2,250, a savings of over $10,000 in interest for just $1 a day. So putting that dollar aside is very beneficial in reducing your credit card debt. A few other things on credit cards that we need to be aware of. I try to avoid at all costs using department store credit cards. They actually have the highest interest rate charges and the highest penalty rate charges. Beware of any reward cards that you do decide to sign up for. Make sure that the reward you're going to be getting at the end of the year will equal the cost of the annual card fee at minimum. And as I said, make sure you pay at least the minimum balance if you're trying to retain your credit rating as equivalent to what it is right now. When you miss one minimum balance rate payment of a credit card, your rating actually drops significantly, and that might affect you in a future home purchase or future car purchase, so it's very important to be careful of that. So where do we save? So as I said, you need to pay yourself off first. So if it's a child receiving allowance, good teaching point is even no matter what the allowance is, if they're receiving $1 a day, then they should be setting aside 10 cents a day. If it's an adult, whatever their paycheck, once you've done your budget, look at what you can start putting set aside. Yeah, it might be difficult at first. Start small. So consider even just 5% of your net pay and putting it aside into a savings account. So the first savings account that you want to set up is a savings account that has your emergency money, I call it, just in case. Let's say, for example, all of a sudden you're out of a job, or you have an unexpected medical situation. So a minimum of 3 to 6 months of your budgeted expenses that you've been tracking, you can set aside into a savings account. Now, when you go to the bank to set up that savings account, there are several different types of savings accounts that you can set up. Ask the bank what the fees on the account are, and also what you can do to actually make sure that you commit yourself to having savings going into it on a regular basis. Let's talk about some other savings accounts that you can set up after you've set up your major savings account. So these are your tax-free savings account, your registered retirement savings plan, a registered education savings plan, and a registered disability savings plan, which I'd like to go through in more detail on the next couple of slides. The following 3 plans, the Registered Retirement Savings Plan, the Registered Retirement Income Fund, and the Tax-Free Savings Accounts, are considered tax deferral plans or tax shelters. So you can all participate in a tax deferral tax shelter plan. Okay? But what they do is they avoid paying tax today, but potentially, depending on which plan we're talking about, you may have to pay tax later. So let's go through each of them in detail. The Registered Retirement Savings Plan. Generally, this plan is for you to invest funds for 20 or more years in preparation for your retirement. With the majority of individuals who now no longer have pension plans from their employer, fewer than 30% of employers are offering company pension plans. The RSP is considered your main source of retirement The government initiated this program to ensure that people do set aside funds for retirement, knowing that both the Old Age Security and the Canada Pension Plan was not going to be providing sufficient income for people to survive in their retirement. So what can you put aside? 18% of your earned income annually can go into your registered retirement savings plan, to a maximum for 2017 of $26,010. The contributions that you make into your RRSP are tax deductible, reducing your net income that's subject to tax. Furthermore, when you have some money set up in your registered retirement savings plan and it's growing for you tax-free, you can actually borrow from yourself. You can borrow up to $25,000 towards purchasing your home, or if you wish, you can borrow later in life to go back to school up to $20,000. So borrowing up to $20,000 later to go back in school, or the home purchase plan of $25,000, in both cases, the government wants you to repay yourself so that it's there for your retirement. Repaying yourself requires monthly and annual repayments. For home buyer plans, you have to repay it back in 15 years. And for your school learning plan of $20,000, it needs to be repaid back in 10 years once you've completed your new schooling. Registered retirement savings plans get converted to what's known as a registered retirement income fund. While the funds remain in the registered income fund, they continue to grow tax-free for your future retirement. Generally speaking, you are required to transfer your monies from your RRSP to your RRIF by no later than the year that you turn age 71. But there's no rule that says you can't transfer earlier. And many people do by when they decide to select early retirement, start getting their registered retirement savings plan funds to them as a pension through their registered retirement income fund. So you get a pension either monthly, quarterly, or annual from the money that you have actually saved over your lifetime. Now, the last vehicle to use is the tax-free savings account. A tax-free savings account started in 2009. It is a savings account which grows again with no tax. Contributions are not tax deductible. But likewise, since the contribution is not tax deductible, any money you withdraw from your tax-free savings account is not taxable. Every year you can contribute amounts. So since 2009, if you've not set up a tax-free savings account, then to date you can have contributed up to $52,000 on your tax-free savings account. This balance continues to grow, and you can continue to make that amount. You not need to do it all at one time. You can actually contribute in small portions. This is a good way where you can get a direct deposit from your employment income saying, I'm going to set aside $200, if that's feasible for you, per paycheck, $50 per paycheck, going directly into your tax-free savings account. Now remember that if you have been contributing on an annual basis, there is an annual maximum, and the 2017 maximum is $5,500. The other good thing about tax-free savings account, it is the best source with regards to for managing your medical expenses if need be, because you can withdraw money from your tax-free savings account and you can replenish it the following year when funds become available to you. So the balance is continuously growing and replenished. You don't lose the room that they provide you, that the government has set as the contribution limit. So, for example, in 1 year, if I actually had taken out $2,000 to manage my medical expenses, then the following year I can put back the $2,000 into the plan when funds are again available. The other savings plan that we have is the Registered Education Savings Plan. Now, the Registered Education Savings Plan was designed specifically to help parents save for their children's post-secondary education. The RESP can be opened up at most financial institutions, but be wary of excessive administrative fees. And also look at the plan document. Does it allow you that when your child is going to school, not only to pay for their tuition and books, but also for their accommodation if they decide to live outside of the town or city that you live in? So you want it to be as broad as possible as to what it defines as educational expenses when setting up your plan. Furthermore, you may want not to set up a plan by child, but a plan for your family of group of children, so that if one child decides not to go to post-secondary education, the funds then revert to the next child that you may want to go to post-secondary education. Grandparents can also open a registered education savings plan for a grandchild. But keep in mind that the total maximum contributions that you can make for a child are $50,000 per child. So you can have two RESPs, one by the parent and one by the grandparent. But the total contributions for that one beneficiary, the child, is only $50,000. Likewise, the total annual Canada Education Savings Grant that one can receive is $500, provided the parent contributes $2,500. Now, you can continue contributing up to the age of 31 years of age for a child into your registered education savings plan. But the government will only provide Canada Education Savings Grants up to the age of 18 years of age. So it is best to set these up early and to put contributions in early, but each year to put in contributions so that they can get you the maximum Canada Education Savings Grant. If you are a low-income family earning less than $45,000, then there is additional funds that can be also granted by the federal government when setting up your registered education savings plan. Once you open up the plan, if you're low income, that's less than $45,000, then you're given a one-time amount of $500. If you make a contribution of $500 and you're low income, the government will give you an additional $100. So instead of receiving only the $500, you will actually get $600 for a full contribution of $2,500. The Registered Disability Savings Plan. The next few slides, I want to go over the Registered Disability Savings Plan. This plan was introduced in 2008, but it is the least understood and the most complex of all tax shelters that the government has offered individuals. First of all, you need to establish a Registered Disability Savings Plan before the age of 60, and only individuals that have qualified for the disability tax credit can actually open a registered disability savings plan. Now, people with type 1 do qualify for the disability tax credit. Of course, you need to apply for the disability tax credit, and you may have heard recently of some difficulties in going through the disability tax credit process, but persevere. And patience is the best rule here in trying to get acceptance for your disability tax credit. I'd be happy to take questions on that, but since I have talked about specifically how to claim your disability tax credit in a previous webinar, I'm not going to go into detail about the DTC on this webinar, but I will talk more on the Registered Disability Savings Plan. So the savings plan was created to, of course, help individuals with disabilities to anticipate their more significant costs that they have. The plan was anticipating for people to save money for a minimum of 10 years before they start withdrawing from the plan. The lifetime maximum contributions that you can make are $200,000. Of course, that can be done in any time period from once you've been qualified to set up your RDSP until age 60. Your contributions are not tax deductible, but the withdrawals, the income that are earned on any withdrawals, that income only is tax payable. So if you make a contribution of $10,000 over your lifetime into your RDSP, and you then come out taking out $11,000, so you've earned $1,000 of income. It is the $1,000 of income that is taxable, not the $10,000 that you originally put into the plan, of course. So opening up a registered disability savings plan. The key issue here is that not all financial institutions, so not all the banks, are offering RDSPs. So please go to the website that I've indicated as to which banks are offering RDSPs. The next thing is that it is you, once you set it up, responsible for claiming and receiving, if you so qualify, Canada Disability Saving Grants and Canadian Disability Savings Bonds, which I'll speak to briefly in a moment. Both the grant and the bond, for you not to pay it back to the government, must remain in the plan for a minimum of 10 years. There has been one significant key change, or actually two, I should say. In January 2011, the government did determine that if you had not previously claimed for a bond or a grant, you could actually go back for 10 years. But since the program only established in 2008, if you made a claim in 2012, you'd only be going back 4 years. But now, if in 2016, you've now for the first time heard that you may have qualified for these bonds and grants but never have claimed for them, you actually can go back in 2016 and ask for a claim for the past 10 years from the government. So the other thing is that a new change that has been proposed, and this was proposed in the March budget, and we have draft documentation on this at this point in time, but we're waiting for final legislation, is the change that if you are no longer eligible for your disability tax credit, in the past, when you no longer were eligible for your disability tax credit, then at that point in time, your registered disability savings plan would get dissolved. But because of advocacy work that we all do to make sure that there's more fairness with regards to the registered disability savings plan, the new rule that will be put in place will ensure the following. If your doctor sends a letter known as an election, though I don't have the form of the election at this point in time, stating that you will be reapplying for the disability tax credit and that in his or her opinion you will qualify for the disability tax credit. For type 1s, you still meet the 14-hour criteria, are still on a life-sustaining support requirement. Then life-sustaining support, I'm talking about in our case, pancreas no longer working, and therefore insulin is a requirement to operate our metabolism. In that case, then you are going to be hopefully requalifying for the disability tax credit. And if you requalify, and provided that requalification occurs in the next 5 years, then your registered disability savings plan can remain open. And while it remains open, you cannot make any further contributions. You're not entitled to any grants or bonds from the government, but any money that you've already invested into your registered disability savings plan can remain in the plan, and they grow tax-free. Once you then qualify for your disability tax credit, you then can go back and apply for that 10-year for the period that you were not in the plan actually getting grants and bonds. So you can go back that 10-year rule that I mentioned earlier and actually claim for the missing bonds and grants. So who's entitled to a bond or a grant? So the bond, first of all, the Canadian Disability Savings Bond is paid to low-income individuals. No contributions need to be made into the Registered Disability Savings Plan. Provided that prior to the age of 49 you apply for this, and if your income is below $26,000, you're entitled to a bond of $1,000. If your income is between $26,000 and $45,000, then you will get a partial payment of the $1,000. Now, the income level is based on the total family income for individuals that are on a disability, they're under the age of 19. After 19, it's based on the individual's income. Even if the individual, the student or person, is still living at home, it's based on their personal income and not the income of the entire family. Registered Disability Savings Plans. The grant. Now, the grant requires you to make a contribution into your savings plan. So if you make a contribution of $1,000 into your savings plan and you have income less than $90,563, then you are going to receive a grant. On the first $500, you will get $1,500. On the next $500, you'll receive $1,000. So it is possible to get $2,500 from having contributed $1,000 into your Registered Disability Savings Plan. If your family income or your individual income after age of 19 is greater than $90,563 and you make a contribution of $1,000, then you'll be receiving a $1,000 grant. In total, you can receive up to $70,000 in grants from the government. Again, it's very important to remember that you need to retain these in here for a minimum of 10 years to not have to pay the grant or the bond back to the government. The Registered Disability Savings Plan starts paying you a pension at age 60. So for most government programs for seniors don't start until 65. So from 60 to 65, it's a really good time to use your RDSP money for your medical expenses that are not covered by the government. Now let's look at medical expenses. As I mentioned earlier, it's really important to keep all your receipts. Maintaining your receipts is vital for making any medical expense claims. And you need to retain your receipts not only for the current year, but also for the past year. And the reason for this is for when you claim your medical expenses, you can choose any 12-month period. So as an example, I may choose March 2015 to February 2016, and then the following year choose June 2016 to May 2017 as the period of 12 months that I had the greatest amount of medical expenses to get the greatest benefit for my medical expense credit that I'm going to receive. In the example I've provided, medical expenses, assuming your medical expenses were $2,800 and your net income is $40,000, so 3% of $40,000 is $1,200. So the first $1,200 is not claimable as a medical expense. But the balance, the $1,600, is an allowed medical expense. Now that I've claimed my $1,600, how much is that really worth to me in my tax payment that I'm going to do? So it'll actually reduce your tax dollars that you have to pay to the government or give you a refund of $360. So what qualifies as medical expenses for the medical expense credit? I've provided a list of a few common expenses for people living with type 1 listed here. Premiums paid to an employer health plan can qualify as medical expense for everyone. I always tell people to keep the last pay slip of the year, so your December 31st or wherever your pay date is in the month of December, to keep that pay slip, because that will determine how much you've paid in total for several different benefits that maybe your employer does not cover. And that slip will be useful for claiming various other credits that you may be qualified for when doing your tax return. If you don't have that last slip, you can also, in some cases, not all employers are doing this, but in some employers, on the T4 slip that you get, you'll see a code 85. That code 85 is the total of all your medical, vision, and dental plan expenses, and you can use that to claim as a medical expense. Likewise, if you travel, your medical insurance that you get while you travel also qualifies as a medical expense. The code payment that you may be making on, for example, if you go to the dentist and the charge is $100, but your insurance only covers for $50, that $50 that you have to pay out of your pocket is a medical expense. What about if you're participating in a provincial pump program, and the pump program offers you $600, but your pump supplies cost you $900? The difference, the $300, it's a medical expense. And if you need to travel for a medical appointment to see a doctor or any medical practitioner, and it's greater than 40 kilometers one way, the travel for yourself and a person to accompany you, including reasonable meals for that travel, are also allowed as medical expenses. So who are the medical practitioners that you can claim medical expenses from? I've provided a list here of all the medical practitioners as defined, but each province determines which they accept. For example, a traditional Chinese medicine practitioner is allowed in both British Columbia and Ontario, but no other province considers traditional Chinese medicine as a medical practitioner at this point in time. So go to the link, look up what medical practitioners qualify in your particular province, collect those receipts, and then when you go to the physiotherapist or you go to see a dental hygienist, collect all those receipts and claim them as your medical expenses. If you participate in any medical plan, a drug plan that the office is offering for seniors or low income, any co-payments you incur or any costs not covered by those plans, then the difference, those are medical expenses that you can claim on your tax return. And I've given a link at the very end listing all the medical programs that are available in each of the provinces. So you can actually review the resources that are available in your province to see if you qualify for any of the particular drug plans based on your particular income. And likewise, with regards to pump supplies, for those of you who are on pumps, remember that pump supplies are available, generally speaking, in most provinces for people under the age of 19, some under the age of 26, and of course in Ontario and Alberta, there's no age limit. But any costs that you incurred that are not covered by the pump supply programs provincially are then covered as medical expenses when you qualify and apply for your medical expense credit in doing your year-end tax return. I thank you very much for listening, and if there are any questions, I will take the questions.
Great. Thank you so much, Diana, for delivering such an amazing presentation. You've provided everyone with excellent tips and, of course, lots of information on how to manage your money and simplify on how to do that. So thank you so much for that. Just a quick thing to everyone, we'll have some time to take questions now. So we have a couple here lined up, but I do want to note that if you do have any additional questions that you either haven't thought of during today's webinar, or if we do not get to your question today, I would like to apologize in advance, but we're happy to assist you if you'd like to email us at webinars@diabetes.ca for those that we don't get to, and we'll be happy to follow up with you and to respond. So Diana, with that being said, I'll start off with our first question here. And I think you had some slides up with some resources there, but I'd like to go ahead and ask this question anyway. Do budgeting tools exist to help me stay on track with budgeting?
Definitely, they do exist, and there are actually some very short books or articles that one can actually read to give them some guide points and some incentive on the different types of expenses. Everything you come out of your pocket, be it by debit card, credit card, or cash, should be recorded for a 30-day period. And you can use, there are several different apps, and the resources, the first couple of tools that I listed on the resource list will provide you direction on how to get those apps that you need.
Perfect. Thank you for that, Diana. Our next participant, who's actually an individual that lives in Ontario, is asking the following. Is it more beneficial to apply for a program such as the Ontario Monitoring for Health program, or to claim their medical expenses on their taxes, or is it possible to do both?
Well, first of all, in terms of cash flow, I always say that if you qualify for the Ontario Monitors program, you should first apply for the Ontario Monitors program, because that is immediate cash that you're getting, not having to put out of your pocket. So that's the first thing you should do. Then the second thing is then any amount that you're having to pay for yourself, you should then pay that, keep those receipts, and then the sum of those receipts, you will then claim your medical expenses when you file your tax return at the end of the year. So you definitely can do both, and you should not hesitate to do both.
Perfect. Thank you so much for that clarification. Our next question here is, what can I do if a product is not covered by my insurance plan? And as an example, the continuous glucose monitor.
So first of all, prescription drugs. All prescription drugs may not be covered under your employer health plan or under even a senior's plan once you become a senior in the province. If you have a prescription for a medical device or a medical product, then that prescription, provided it's prescribed by a medical practitioner that qualifies in your particular province, then that prescription then qualifies as a medical expense. So your cost for your continuous glucose monitoring, provided you had your endo write a prescription for it, or your family physician, whoever serves you, then on that case you can then proceed to claim it as a medical expense.
Perfect for that response. Thank you so much, Diana. Folks, I am noticing that there's some really great questions coming up around the disability tax credit. So as Diana had mentioned previously, she's done a great webinar for us on that. That is available on our website at diabetes.ca/past webinars. Be sure to check that out, but also please email us at webinars@diabetes.ca, and we'll be happy to help you one-on-one with all of the questions that relate to the disability tax credit. We work closely with Diana, and she's been very supportive to help us on that as well. So please feel free to do so. With that being said, Diana, I'll take our next question here. Our next participant has said, I'm planning for my child's future. How much should I be saving to ensure that they are able to manage costs for diabetes as they grow up?
Oh, that's very difficult, first of all, to determine the total amount that you should save for your child. They actually say that you can save up to $250,000 for your child to manage their growth up to age of 24, or 10,000 times their age. That's what I've been told at one point in time. But in terms of your registered education savings plan, I would want to make sure that you actually start that as early as possible, because then it grows tax-free in there. And by making contributions, as I said earlier, putting $2,500 aside every year, you can easily accumulate, well over the $50,000 through the earnings, because they're not being taxed while the money is in the account. So it's well worth doing that. I guess that's all I really can say. It really varies from person to person. There's a very good tool that talks about money and your kids that I have indicated as one of the sources that I would suggest that all parents should actually go through in doing that budgeting and tracking your budgeting costs. That's not only for the parent in the family, that's for every member in the family. So all of you should be tracking all your expenses for an entire month and actually seeing how they each spend their respective money.
Thanks for that, Diana. And I do want to let everybody know that Diana has quite a few resources listed here within the webinar. So again, if you'd like those resources sent to you by email, please feel free to email us at webinars.diabetes@diabetes.ca, and we'll be happy to send out the links to the resources from our webinar today. We'll just take a couple more questions here, Diana. So our next question here is, well, I guess we've already answered that one in terms of the disability savings plan. So one of our participants has asked if premiums from private health plans are eligible as a medical expense.
So health plans, if you're referring to your premium that you pay for your dental, medical, vision care, hospital care, all of those premiums apply, and they do qualify as medical expenses. If you are referring to a premium that you pay for a life insurance policy, that does not qualify. Or for a long-term disability plan, that does not qualify. But premiums for medical expenses of every nature you can think of do qualify as a medical expense.
Thanks for that, Diana. We will take our last question here. And again, a reminder that we do apologize if we didn't get to your questions today, but feel free to email us at webinars@diabetes.ca, and we'll be sure to get back to you. So this individual has said that they have been approved for the government's disability credit at the age of 62, and they're wondering if they can go back for the disability grant. Is it better than the RRSP contribution?
First of all, it depends when you actually opened up your registered disability savings plan in that case. So if you've been qualified for the DTC at age 62, depending on your letter that you received, did it give you an effective date? If it gave you an effective date when you were still in your age 55, let's say, because generally it can go back up to 10 years. So it could go back as early as age 52. Then you could have had a registered disability savings plan between age 52 to age 60. That will not give you any of the grants or bonds because they do not actually pay out any grants or bonds after age 49. But any further details on this would be best to speak on a one-to-one basis with your financial advisor. And if you have further questions, you can certainly call the 1-800 Banting line number.
Perfect. Once again, Diana, thank you so much for that thorough response. Folks, that does conclude our webinar today. I'd sincerely like to thank Diana for speaking on behalf of Diabetes Canada. It's been a great learning experience. Again, I do want to remind everyone that today's webinar has been recorded and will be made available at our Diabetes Canada website in the coming weeks. Please be sure to check out our upcoming Type 1 webinar. It will be the last webinar of the year and especially of our Type 1 series. So next week we will be hosting a webinar on new and emerging technology in diabetes management that Lori Berard will be presenting on. So for more information and to register, visit diabetes.ca/webinars. Diabetes Canada would like to take the time to recommend you to reach out to your family and friends and colleagues to take the CAN risk test so that everyone's aware of their risk of developing diabetes. So for more information and to access the test online, please visit www.diabetestest.ca. And for those of you looking for more support and resources to live well with diabetes, please feel free to call our toll-free line at 1-800-BANTING. That's 1-800-226-8464. Thank you for joining us today. We hope you've enjoyed learning with Diabetes Canada, and we look forward to your participation in the future.